Chattanooga's primary hospital, Erlanger, opened in 1889, accepting only white patients. In 1899, Erlanger began accepting black patients, opening the basement to black males and the fourth floor to black females. However, no black doctors or nurses were allowed to practice at Erlanger. In 1915, after being lobbied by several ministers, Erlanger closed the basement ward and moved its black male patients to a separate area on the first floor. Perhaps Erlanger was partially influenced by the rapid success of the new privately operated Walden Hospital. The first hospital focused on the care of the city's colored population. Just after her graduation from Meharry Medical College in 1910, Dr. Emma Wheeler arrived in Chattanooga to begin her medical practice. Within 10 years, Dr. Wheeler purchased 2 lots on the corner of Douglas and East 8th Street, where she built a 3-story hospital. Large enough to accommodate 39 beds, 9 private rooms, and an additional 12-bed maternity ward, Walden Hospital was staffed by 2 house doctors and 3 nurses. 17 other physicians and surgeons maintained patient visiting rights in the hospital. Within Walden Hospital, Dr. Wheeler also operated a nurses' training school similar to the all-white nursing school at Erlanger Hospital. For over 20 years, Dr. Wheeler trained nurses to work in hospitals across the South. In 1951, as her health declined and she sought to close her nursing school, Dr. Wheeler asked Erlanger to open its nursing school to any applicant qualifying for admittance. Erlanger declined the request. In June 1953, Dr. Wheeler retired from her practice and closed Walden Hospital. Even with a private hospital for Chattanooga's black population, pressure remained on the city's public hospital, Erlanger, to provide better service for blacks. In 1947, Erlanger opened Carver Memorial Hospital on West 9th Street. With the opening of the hospital, staffed solely by black doctors and nurses, Erlanger no longer admitted black patients. Just after the closing of Dr. Wheeler's Walden Hospital, local citizens asked that Erlanger again admit black patients and allow blacks to enter its nurse training program. Again, both requests were denied. As the civil rights movement continued in the South, city leaders pressured Erlanger to accept black patients. In 1962, Erlanger closed Carver Memorial Hospital and moved all black patients to a new colored wing at the hospital. The first black doctor received patient visiting rights at Erlanger in 1964. With the passage of the Civil Rights Act the same year, Erlanger was forced to change its segregated policies and in February 1965 reported that all patient units within the hospital were desegregated.